More than 42,000 Americans died from an opioid overdose in 2016. That's according to data out Thursday from the CDC. It's a 28% increase from the previous year. The number of people overdosing on synthetic opiates like fentanyl more than doubled from 2015. Opioid deaths contributed to a drop in average life expectancy for Americans for the second year in a row. The last time average life expectancy fell was during the AIDS epidemic. Keith Humphreys is professor of psychiatry at Stanford University. He's with me now from Stanford. Welcome to you.
Nice to see you.
Well, what strikes you most from this CDC data for 2016?
Well, as scary as it is to see the raw numbers going up, the fact is the rate is also going up. So in other words, we're not at the peak of the epidemic yet. And next year, as horrible as these numbers are, next year is probably going to be worse because deaths are still accelerating.
Well, as we mentioned, the number of overdoses from synthetic opioids doubled. What role are synthetic opioids playing in this crisis?
Well, they've been very devastating because they've been introduced into the heroin supply through China and through Mexico, which supply that market. And fentanyl is dramatically more potent than heroin and can cause an overdose instantly, stopping breathing and ending someone's life. And because you can't ever tell whether or not a particular batch of heroin has fentanyl in it, it's really a game of Russian roulette for the user.
Well, the last time life expectancy fell year to year was during the AIDS epidemic. What does the decrease tell you about the scope of this crisis?
Well, for the last few years, I've been saying, that this is as bad as the AIDS epidemic. And I think seeing these new numbers, I would say it's actually worse than the AIDS epidemic. I mean, the opioid numbers alone, about 42,000, and we know that's likely an undercount. The true count's probably about 50,000. That alone exceeds the worst year of the AIDS epidemic. And in AIDS, we had eventually a treatment. We were able to at least help people. At this point, the things we're trying aren't working, and it looks like this problem keeps getting worse. So this is really a public health disaster, worse than anything in my lifetime.
Well, President Trump declared the opioid crisis a public health emergency earlier this year. What's your assessment of the government's handling of this problem?
Well, the president has made a couple of declarations, and he's had a commission that gave him advice, but he hasn't actually done anything. There hasn't been a penny allocated to this problem. There hasn't been sustained attention to it. So, unfortunately, I think it's been complete failure at the federal level to this point. There are cities and states that are really working heroically to save people who are addicted to opioids, to try to keep communities safe, but they are not getting the leadership they need at the federal level.
All right, Professor Keith Humphreys. Professor, thanks very much for your time.
Thank you.